Hello, my name's Sarah Wombell and I'm the Senior Clinical Nurse Specialist for the Chronic Pain Services at Barking, Havering and Redbridge University Hospitals NHS Trust. So part of the pain management programme today we're going to talk about flare-up planning. So the aims of this session are to learn about flare-ups, to identify early indicators of a flare-up, to learn techniques to manage a flare-up, and hopefully by the end of this session you'll have your own individual action plan to help manage your pain more effectively. So what is a flare-up? A flare-up is a considerable increase in pain intensity from your normal level of chronic pain. We know that flare-ups are a normal experience when we have a chronic pain condition, and we know that flare-ups can last from a few seconds when we may experience a shooting sensation. They can last for a few minutes when we get cramp, or they can last for a few weeks when we generally get an increase in pain from our normal levels. So I want you to take a few minutes to think about your own flare-up. What sensations do you experience? How does the flare-up make you feel? What emotions do you have? And what impact does the flare-up have on your day-to-day activities? We find frequently that when we get an increase in pain, we start to have unnecessary thoughts and we start to worry about this increase in pain. We start to think lots of different questions, and was it something I did? Or did I bend down to empty that washing machine the wrong way? Maybe I shouldn't have cleaned the house and then gone and done the gardening. Perhaps I did too many activities. Or perhaps I rested too much and stayed in bed for too long. What then starts to happen is these thoughts and questions that we're having start to spiral out of control. We start to catastrophise and worry that perhaps this pain has changed and something may be going wrong. We worry that, do we need another MRI scan? Do we need to change our medications? Do we need to see our doctor? And it's rather like a volcano going off in our mind. It's like an explosion of thoughts and worries and fears about this increase in pain. So we're catastrophising, so we need to apply some logic. So when we're talking about flare-ups, let's break it down into separate categories. So let's look at what can cause a flare-up. Let's think about the activities. An unexpected movement, as we've said already, bending down to empty the washing machine, or bending down to tend to the plants, could cause an increase in pain. Maybe you did something you don't normally do, so perhaps you went to a wedding. Maybe you did more than you should have done, and you didn't pace correctly, so perhaps you cleaned the house without resting between each room. Maybe you went to the cinema, or maybe you watched a film and sat in the same position for too long. Let's look at the next category, weather. We know that when it's wet, damp, raining, that this can cause an increase in our pain. But on the other hand, when we have extreme weather conditions, such as heat waves or humid temperatures, this too can have an effect on our pain levels. What about stress? When we're tense, our muscles tighten up, which can cause an increase in our pain. Or if we're emotionally upset, we can release chemicals that can also have an impact on our pain. What about if we feel generally unwell? We have a cough, cold or flu. This can also have an impact on our pain. And sometimes a flare-up will just happen for no reason, and we cannot identify any precipitating factors. We've already mentioned that when we have a flare-up, we can sometimes have unhelpful thoughts, and we can dwell on unpleasant things, and we can panic. And that's why preparing for a flare-up and have a management plan in place is really important, because it's going to make your flare-up easier to deal with. There's two steps to your management plan. The first step is identifying your early indicators, and the second step is the actual action plan. What are you going to do to help manage your flare-up? So let's look at some early indicators of a flare-up. Let's think about the physical signs that you may experience. You may be getting some more pins and needles, or an increase in frequency of spasms that could explain why you're going to have a flare-up. You may have had a bad night's sleep, and you know that after that you're going to get an increase in pain. Maybe you've done some different activities. Perhaps you've been to a wedding, you've socialised with friends, or been to a concert, and you know that this is likely to cause an increase in pain. What about psychological signs? Perhaps you've got an exam to prepare for, or you've got to put your car through an MOT, and you know that these sorts of things are going to make you worry and again cause an increase in pain. I want you now to access your flare-up planning sheet, which you can find in your Pain Management Programme folder that you were issued at the start of the programme. You can see from the flare-up sheet, step 1, I want you to start thinking of your own examples regarding your early warning signs. Think of things that are going to indicate that you might be going into a flare-up or that you might be having an increase in pain. Write these down and then keep this flare-up plan to hand. So, you're starting to have a flare-up, you're getting an increase in pain. I want you to keep calm, and now let's make an action plan. Don't ignore your flare-up. Begin the treatment as soon as possible. Research has shown that individuals who retain their self-confidence and have a positive attitude through a flare-up are more likely to handle the episode better. Set realistic goals. Getting rid of the pain is quite unrealistic, and therefore some reduction in your pain intensity is far more acceptable. Think about your breathing. You may have learnt some mindfulness techniques already on the Pain Management Programme, and it may be time to start using these. We know that when we're tensed and we have muscles that are tight and we have rapid, shallow breathing, that this can precede a flare-up. So you need to start using your mindfulness techniques. Practice slow, deep breathing. This will have a calming effect on your overall health and will help it easier for you to control the flare-up. Communicate. Ask your family and friends for help. Explain to them that you're having a flare-up. Tell them the activities that you can do, but that you might need help with other things. During a flare-up, you may want to think about your medications. Whilst you're on the Pain Management Programme, you will have a one-to-one session with a clinical nurse specialist who will talk to you about medications that you can use during a flare-up. Alternatively, you may want to contact your GP for further advice during this period. We've already mentioned that certain activities can increase your pain and cause a flare-up. And when you're having a flare-up, you may want to reduce these activities. We know that resting for short term can help, but prolonged bed rest or laying down for long periods is not going to help your flare-up. We need you to start mobilising slowly. Introduce some gentle stretches. Exercises such as Tai Chi all could be very helpful when you're having a flare-up. Think about pacing. You may have already learnt this on the Pain Management Programme already. And think about the techniques that you're going to apply. Gradually increase your activity level slowly and don't rush when you're having a flare-up. You may also want to think about alternative therapies. Distraction is a very effective way of reducing your awareness of pain, and research has shown that when we're distracted, when we're doing something we enjoy, we release chemicals such as endorphins that can actually reduce our pain levels and have a calming effect on our overall health. One distraction method is actually to create a flare-up box. Now, I've already talked about that when we're having an increase in pain, it's difficult to think straight, we're worrying, we're panicking. But if you have a flare-up box that is individual to you, you can go to it and access the things that you've put in it. You may have, for example, your favourite film. You may have a television show that makes you laugh. You may want to use some aromatherapy, candles. What about some photographs of an event that you went to that you enjoyed? Again, photographs that make you happy and distract you. What about in your flare-up box putting a book with inspirational quotes in? You may want to have a colour therapy book to hand. You may want to have some crystals in your flare-up box. Again, a very good distraction technique. for looking at the different patterns and colours that are made on the crystal. You may want to think of your own examples as well. And again, this flare-up box is going to be very individual to you. So I now want you to get your flare-up planning sheet out again and start to complete step 2 of the plan. Think about the different strategies that we've just talked about and the things that are going to be suitable to help manage your flare-up. It may be that you just want to create a flare-up box, or it may be that you want to use a combination of different techniques, such as mindfulness, stretching, flare-up box, but it's going to be individual to you, and it's going to be your action plan. Write these things down and then keep the plan to hand. Think about barriers to the plan. So often we'll say, well, I don't need a plan, I can cope with this flare-up. But often it is that you need that plan. Not having the plan to hand, think of somewhere you can put the plan, perhaps put it on your fridge, or like I said, if you've got a flare-up box, that's something you can go to with all the activities that you need. When we're feeling low in mood or when we're catastrophising, we can't think straight, and that's why it's really important to have our action plan to hand. So just remember, how you react to a flare-up can make a difference to how often you have a flare-up, how long the flare-up lasts, how severe they are, and your overall mood and attitude. And if you've got a flare-up plan and a management plan, it's going to be easier to manage your flare-up. Finally, I want you to remember that having a flare-up does not mean that more damage is done. Increase in pain does not mean that your condition is getting worse. And a flare-up does not necessarily mean that there is a new cause for this increase in pain. I'd like to leave you with this final thought. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. We know that flare-ups are part of having a chronic pain condition. Accepting that a flare-up can be managed. Have a flare-up plan to hand. Think about using a flare-up box or other strategies that are going to help you. Thank you for listening, and I hope you enjoyed the session.